Okay, now personal question. How are you feeling with PD classes?
Yes, sir. Fantastic, sir. I have gained so much confidence after joining the class.
Yes, Dr. Arindam. I want, first of all, you should tell us about your achievements of life.
Yes, sir. I have scored excellent marks in my first year MBBS. For that, I have got a gold medal. And from my second year MBBS till my sixth year MBBS, I have got 30% scholarship for my excellency. And I was the topper in my 10th standard and 12th standard board exams. And I have attended a seminar for organ transplantation, and I have a certificate for that, sir.
Okay, what is the role of medical officer?
The role of medical officer to guide the staffs in the PSCs, conduct meetings regarding the implementation of the programs implemented by the Medical Council of India, and maintaining the supply, demand, and cold chain vaccine, and attending OPs, and conducting camps, and organizing the works for the staffs in the PSC and Ayush doctors.
Okay. Now my next question to you is, like, you are coming in armed medical corps, so you must be knowing something about AMC. So please tell about armed medical corps. What do you know about it?
Yes, sir. The Army Medical Corps are a special branch in the Indian Army. They take care of the people who work in the army and their families. And there are three divisions in the army: Army, Navy, and Air Force. The Army Medical Corps are posted in all these three departments. And there are staff service commission and permanent commission. Those who opt to join PG in AMC, they can write NEET PG exam and they can secure a seat with good marks, and they can work here if they opt for permanent commission.
Okay, wonderful. What are the causes of upper GI bleed?
Malady this year,
Okay.
septic ulcer, chronic alcoholism, and aortic artery aneurysm rupture.
Okay. And what are the causes of lower GI bleed?
Hemorrhoids, inflammatory bowel syndrome, ulcerative colitis, and perianal fistulas and fissures.
Okay. Now my next question to you is, how many, there are different types of bites: snake bite, dog bite, cat bite. So what do you have read nowadays in which you are comfortable in answering?
Snake bites, I know.
Yes, you can talk on snake bite, no problem.
Okay, so there are venomous snakes and non-venomous snakes.
Okay.
Some snakes cause neurotoxicity.
Okay.
Some snakes cause hemotoxicity.
Okay.
And we should treat the snake bite according to the species of the snake. We should first of all find which snake has bitten the patient, and we should administer ASV accordingly. First of all, we should check the vitals of the patient. If he is stable, we should do whole blood clotting time. If it clots less than 20 minutes, we should repeat the whole blood clotting time test once again. We should check his bleeding time and clotting time, and we should check his liver function test, kidney function test, and his complete blood counts. and we should manage accordingly each and every snake bite.
Okay. You belong to which city?
Yes, sir. I belong to Tiruvannamalai district from the state of Tamil Nadu, which is the famous religious site in Tamil Nadu, which is famously known for its
Okay.
festival every year.
Okay. So what language, what is your regional language over there?
Tamil, sir.
Tamil. Tell us something about yourself in Tamil language.
ஓகே சார். என்னுடைய பெயர் அரவிந்தன். நான் மருத்துவம் பயின்றிருக்கிறேன். நான் முதலாம் ஆண்டு சிறந்த மாணவனுக்கான தங்கப்பதக்கம் வென்றிருக்கிறேன். தற்போது ஒரு தனியார் மருத்துவமனையில்.
Tell us about your hobbies and strengths in Tamil.
தமிழ் ஓகே சார். நான் வழக்கமாக இறகுப்பந்து விளையாடுவேன். வார இதழ்கள் படிப்பேன். நான் புதிய இடங்களுக்கு செல்வேன். என்னுடைய பக்கபலமாக நான் எந்த பிரச்சனை வந்தாலும் இதை தைரியமாக எதிர்கொள்வேன். உடைந்து விட மாட்டேன். நான் புதிய மனிதர்களுடன் சகஜமாக பழகுவேன். எந்தவித கூச்சமும் இன்றி அனைவரையும் சமமாக நடத்துவேன்.
Okay, you are comfortable with speaking Tamil, no problem, right?
Yes, sir.
How many languages you know?
Yes, sir. I can read and write English, sir. I can read and write Tamil. Then I can read and write Russian language, sir.
Russian?
Yes, sir. I have learned it from my university.
Very good. So, can you speak Russian?
Yes, sir. Little bit I can speak.
Okay. Then you can tell us about your family in Russia.
Yes, sir. Sure. Years out, Arvind, my papa, robotic director schooling, and teachers, PPC as well. My name is Adin Dad. In robotic teachers and banker. Anyway, yes, Adin Devushka, it's it. One teacher with Deutsch teachers. Anyway, yes, Adin Devushka teachers. My mama met me at the, yes, with Bill. Yeah, teachers watch about it to my university.
I want you to speak on aminoglycosides.
Aminoglycosides are a class of antibiotics that are usually given for pre-operative patients and all kind of febrile illnesses and ENT diseases, and they are very much ototoxic and vestibulotoxic. And
okay, enough. You have done your MBBS in Kyrgyzstan. So what difference you found among in India and in Kyrgyzstan education?
Yes, sir. The major difference is there are only a few people are living in Kyrgyzstan, sir. So the exposure to the patients and practical knowledge is comparatively lesser than India, sir. Because here the population is extremely high and you get more chance to interact with patients directly. But it's very, very lesser in other countries except India.
Okay.
And we get lesser chance to do medical procedures ourselves. We are only allowed to just look at them and observe, not to do practice anything till we graduate.
You mean to say in India we get less chance, or there we get less chance?
Sir, there we get less chance. Here the chance for the baby.
But I think Kyrgyzstan MBBS is 6 years.
Yes, sir.
Then you get more exposure of 1 year, studies more as compared to India. Don't you think so?
No, sir. It's just a theoretical, full and full, not with patients, sir.
Okay, but in India we get more patients. You mean to say to go with practical aspects, right?
Yes, sir.
Okay. The difference. Okay. Okay, so you said you are very intelligent and you got a scholarship also in Kyrgyzstan.
Yes, sir. From my
Great.
second issue.
Okay. Okay, now my question to you is like you are coming in armed medical corps, so you must be knowing about something about AMC. कुछ idea है आपको AMC के बारे में?
Yes, sir.
Please tell. What do you know about AMC?
It is an organization of doctors and dentists. The Army Medical Corps is a branch that take care of the health of the army people and their families. First of all, we can enter as a medical officer in the captain rank. Mm, After years of experience, we get promoted to the higher rank in the army. And army medical corps played a vital role during the Kargil war and all kind of wars. And in the
Okay.
they go to the borders regularly and help injured soldiers in every border camps of India.
Okay. I want to know, like, in medical terms, how many types of fever are there?
Yes, sir. Viral fever, bacterial fever, fever of unknown origin, malarial fever, dengue fever, uh, rickettsial fever,
Okay.
uh,
So can you tell me something about pyrexia of unknown origin? Can you tell me about it?
yes, sir.
Please.
We can't figure out the source of the fever after conducting all kind of blood examination.
Okay.
It's a diagnosis of exclusion, sir.
Okay.
And we can exclude if all the causes, known causes of fever are ruled out.
Okay. Okay. Can you speak on ENT manifestations of HIV or AIDS?
Yes, sir. In throat, we get oral candidiasis if, in a HIV patient, and we get oral thrush. For that,
Okay.
we should give candid ointments. In most, we can get mucormycosis. And in air, we sometimes get co-infections like otitis externa, CSOM, SOM, and if we can get non-healing ulcers in our gums and oral mucosa.
Okay. Tell me the DD, differential diagnosis of central chest pain.
MI, gastritis,
Okay.
then cardiac arrest,
Right.
then abdominal aneurysmal ruptures,
Okay.
then esophageal
Pardon?
diseases like GERD,
Okay. Gastroesophageal reflux disorder.
yes, sir.
Okay.
Then in peptic ulcer also we get sometimes referred pain in the chest.
Okay. Tell me universal donor and recipient blood groups.
Yes, sir. Universal donor is O negative, sir. Universal recipient is AB negative, sir.
Okay. And speak on left iliac fossa acute abdomen.
Yes, sir. In kidney stones, urinary calculi and bladder calculi, we get pain in the left iliac fossa, and in bust abdomen also we get due to like sigmoid colon diverticulosis and any perforations in the large intestine and small intestine, we get pain in the left iliac fossa, and in UTI also we get pain in left iliac fossa. And sometimes we get thrills in the left iliac fossa due to ascites fluid.
Speak loudly.
Okay, sir.
Okay, tell me the contraceptive methods.
Yes, sir. There are oral contraceptive, operative contraceptives, and skin implants, and male and female. Male we do vasectomy, and in females we do tubectomy for permanent sterilization. And it is temporary. We can do Mala D, Mala N, progesterones, and we can do Narathistan or Naplant skin implant, or we can put copper T, which will be a contraceptive. We can place it in the uterus. It can act for 10 years, and we can use condoms in male, and also there is a new type of condom that is diaphragm in females, and we can do calendar method where we do intercourse with regular intervals other than the fertile basis.
Okay, my next topic is congenital malformation of uterus.
Yes, sir. There may be a uterine didelphys. There may be a single uterine fundus, or there may be absent of one side fallopian tubes, or there are some Mayer Rakitansky condition. There will be complete absence of the uterus.
In army life, there are chances of varicose veins. So this question is mostly
Yes.
asked about varicose
Okay,
veins. So answer,
yes, sir.
but you should speak little loudly, okay? Little loud.
Yes, sir. For preventing the varicose veins, we should not continuously stand for a longer time. We can take intervals of sitting, and we can use scrub bandages and give compression for the veins. And if at all it is an extensive varicose vein, we can do Trendelenburg operation and reverse the varicose veins.
My next question to you is, what is the meaning of Arvindan?
Yes, sir. My name's meaning is lotus, and my name matches my personality as I'm a philanthropist, honest, and sincere person.
You know the meaning of what does lotus means?
Yes, sir. Lotus means purity, sir.
Okay. Okay, you preferred army as your first.
No, sir. Air Force.
You preferred Air Force. So tell us something about Air Force. What do you know about Air Force?
Yes, sir. Indian Air Force actually do protect the Air Force attacks from the neighboring countries like Pakistan, Bangladesh, and China, sir.
Okay.
We did many surgical strikes using our Air Force, sir.
Right.
Where we can use our soldiers or just an automated aircraft and attack the neighboring countries, sir, without any man.
Okay. Causes of generalized lymphedema.
Yes, sir. It can be due to elephantiasis, filariasis, Then fluid volume overload, heart failure,
Okay.
and then some cases when liver failure also get edematous lymph nodes.
What is adenomyosis?
Yes, sir. It is the inflammation of endometrial cavity. You
Okay.
get more and more layers of proliferation of endometrial cells. Yes, sir.
Okay, now I'm asking easy question from you. Tell about asthma.
Yes, sir. Asthma means hypersensitivity of the major bronchus. The sign symptoms are cough, shortness of breath, and unable to do daily works. It can be triggered by majorly exercises, any allergens, pollen grains, and some people get triggered by some kind of drugs. If it is an extensive attack, we call it status asthmaticus, which is an emergency. We treat asthma by giving hydrocortisones, bronchodilators, and which is there are two kind of bronchodilators, short acting and long acting, and we sometimes add steroids control the asthma attack, and we should avoid the triggers which lead to asthma. It is just there are currently only symptomatic treatment available. There is no curative treatment. We should just change the lifestyle, and we can control it.
Okay, now personal question. How are you feeling with PD classes?
Yes, sir. Fantastic, sir. I have gained so much confidence after joining the class.
Okay. So it is our duty also to make you confident in more manner also, right? Like, although I am satisfied with your knowledge regarding medical, really very good knowledge, but I want the way of sharing the knowledge should be with more energy or should be with more passion. That should. Okay. Since it's the first time you are coming in front of me as an interview. So although by last 5, 7, 6 days, we were just studying. We were not used to with interviews, but today you have come up with interviews. So it's your first session with interview.
Yes,
No
sir.
problem. Although you answered very well. Okay. I'm very happy with you. But I want one more mock session with you as early as possible.